Hi everyone, I'm your nurse Romanus Amarachi Merit. Welcome to this episode of Merit Health Chat. It's time for some health chat. Let's discuss health. Okay, our topic of discussion today is the effect of gonorrhea in the body of a woman. In our previous episode, we have discussed about the effect of gonorrhea in the body of a man. Please go and watch it. Thank you. So our topic today is the effect of gonorrhea in the body of a woman. Listen. In the body of a woman, gonorrhea is known to spread through every cells, tissue, organ in the pelvic region, causing pelvic inflammatory disease. This is the inflammation of every cells, organ, tissue, or system in the pelvic region, be it the urinary tract, be it the reproductive tract. It affects every tissue there. It causes the inflammation of every tissue there. Okay, what are the signs and symptoms of this gonorrhea in the body of a woman? First, she will discover unusual vaginal discharge. And this discharge will be unusually watery. It may be yellow in color or green in color. The next signs and symptoms she will notice is pain and burning sensation while urinating. Whenever she wants to urinate, she will experience this pain during her urination, and this condition will be very uncomfortable for her. The next sign and symptom she will notice if she has gonorrhea is tenderness and pains in her lower abdominal region. Now, every part of her abdominal region will be giving her pains due to these inflammations, remember. And the next sign and symptom she will notice if she has this gonorrhea is bleeding between periods. Let's say you have seen your menses, between the space, that 28 cycle, between the cycle, it haven't reached your next menses, you are bleeding. This is what gonorrhea can cause. Another sign and symptoms of this gonorrhea is heavy menstrual flow. Your menstrual flow will be flowing very heavily, unlike before. Yeah, some people normally have heavy menstrual flow, but you can experience some abnormal heavy menstrual flow. This is what gonorrhea can cause. Another sign and symptom of this gonorrhea is bleeding after sex. Remember, it causes inflammation of everything in the pelvic region because everything there has been inflamed. So if he or she indulges in an intercourse, that will be bleeding after sex. Remember, we are focusing on women now. Okay, what are the effects of this gonorrhea in her body? Number one effect of this gonorrhea in the body of a woman, especially if she's pregnant, she will experience miscarriage. Listen, every tissue in her system is inflamed, being caused by this gonorrhea. So due to the trauma that has been done by the gonorrhea to her pelvic region and every organ in her reproductive tract, she has chances of having a miscarriage. Okay, the next effect of this gonorrhea in the body of this woman is premature labor. Let's say she survived, there wasn't any miscarriage. Remember, the pelvic region is still traumatized, pelvic inflammatory diseases. So it may lead her to premature labor or giving birth to a preterm child. And this premature labor might endanger her life and the life of her baby. If at all she have a self-delivery, the baby is now a premature and is predisposed to some conditions that is not healthy. Okay, the next effect of this gonorrhea in the body of a woman is that, remember, that baby that is born from a mother that has gonorrhea is going to suffer from some infections, and this infection will cause conjunctivitis. That's the inflammation of the eyes, because this gonorrhea somehow gets to the baby's eyes. And if nothing is done to treat such babies, they will end up losing their sight, loss of vision. Okay, so a baby that is born through this condition should be given proper and immediate care to avoid losing their sight. Okay, the next effect of this gonorrhea in the body of a woman is long-time pelvic pain, due to the trauma and the inflammation that this disease causes to the pelvic region. So she will be experiencing these long-term pains. should be like, oh, I'm having this low back pain, I'm not comfortable, that. This is what gonorrhea can cause. Long term means that you can treat it for now and it comes back until you treat what is actually causing it, which is this gonorrhea. You might be taking pains, relief drugs. That's not the solution. The solution is to treat the cause of the pain, which is gonorrhea. Okay. The next effect you'll be noticing is inflammation of our urinary tract. Like I said, it traumatizes every system and organ tissue in the pelvic region, and the urinary tract is in the pelvic region. So it will cause damages to the urinary tract. It might block the urinary tract. It might as well, the urinary tract might as well be infected, leading to damage of the kidney. So it can lead to many damages of the urinary tract. So if you notice any sign of this, you should treat it properly and immediate effect. So the next effect of this gonorrhea is ectopic pregnancy. Remember, because of the trauma it causes to the pelvic region, let's go over to the reproductive tract now. Let's leave the urinary tract. To the reproductive tract, its healing due to the inflammations and trauma, its healing might form a scar tissue. Scar tissue means, have you seen a wound on your skin? Whenever it's going, it might form a scar. Your skin will not be as it used to be. So this scar tissue might form inside your body and end up blocking the flow of egg. And let's say you have sexual intercourse and fertilization takes place. This fertilized egg now can't move down to the uterus, that's the womb, because gonorrhea has caused scar tissue formation, and this scar tissue formation is inhibiting the fertilized egg from going down to the uterus, causing ectopic pregnancy. Ectopic pregnancy is the pregnancy that occurs outside the uterus. It might be in the fallopian tube, it might be anywhere else. We have different types of ectopic pregnancy. Okay, so when this occurs, it might endanger the life of the woman, cause bleeding, and if this fertilized egg ends up growing in the fallopian tube, which is not the usual part it should grow in, it might cause the rupture of the fallopian tube, finally leading to infertility. Gonorrhea itself can cause infertility through ectopic pregnancy or through different forms by destroying the ovary or ovary that produces the egg now, or by destroying the womb. The woman now can't harbor this child, which will lead to miscarriage. It might lead to infertility in different forms. So this gonorrhea is something that should be given an immediate treatment. Let's all join hands and fight against gonorrhea. Thank you so much for being part of this show to this level. I am Romanus Amarachi Merit, your favorite nurse. Okay, join us now next episode and be a part of what we're doing. Subscribe to our YouTube channel, like our video, comment, make sure you drop your comment, okay? And share this with your families and friends. Let them know about this gonorrhea. Let's fight gonorrhea together. Stay healthy. Thank you.